you're getting what scientists are learning in real time. They recognized that it was moving very fast and that it was on a trajectory that was calculated to potentially hit Earth.
You're inside a correctional facility, and all of a sudden you get a phone call from a loved one at home who says, I have pancreatic cancer. There's nowhere to go to find out what that means.
You're going to see cost inflation on the EV side of things too, and so it's, I think it's kind of a headwind for both gas and electric cars.
Those are the voices of some of the thinkers, leaders, and community members who we speak with each and every day here on the Metro. Welcome back to the show. I'm Robin Vincent. From Grand Rapids, Banff Health is bringing the future of medicine into the present. It uses full body scans and smart AI tools to spot disease earlier and choose the right treatment for each patient. The AI algorithms analyze images in seconds. Now, this helps doctors find tiny tumors, plan therapies, and adjust care on the fly. Researchers at the National Cancer Institute say this might be the next big shift in precision medicine. So is this kind of technology the future of healthcare? And where does it fall short? Banff is expanding with a Detroit facility in the fall. So I recently sat down with Dr. Anthony Chang, its founder and CEO. We discussed how AI and advanced imaging are changing healthcare and what it means for you. So first, let's start with the basics. What exactly does Banff's full body scan and AI platform do step by step in a simple explanation from, let's say, from patient arrival to diagnostic report?
Yeah, so the concept is actually we're trying to catch the disease in the earliest phase. And basically, it's like a way earlier than which current imaging technology can take. If you look at the term you heard from clinic, like MRI, CT, ultrasound, they are all anatomical images, looking for the morphology difference, like meaning something shouldn't be there is there, and maybe something wrong, but is it real or it's just some false alert? You have no idea. But the key issue is like you have to wait until the tumor or disease grow to a certain size.
Wow.
To the resolution, till the scanner can see it, then you can identify that, right? So, what we are trying to do is actually totally change the game. We're trying to detect the molecular level change before the morphology level change. So our technology is using the scanner called PET scanner, PET, positron emission tomography. But the key issue is we have a wide variety of radiopharmaceuticals. These are the molecular tracers or molecular level drones designed to looking for specific disease. For example, prostate cancer wearing yellow hat. And so we designed a tracer, a drone, only looking for the yellow hat. And then so we inject this tracer into the body, it will circulate over the body. Once they find a yellow hat, it means it's prostate cancer. They will bind to it, send out signal, and we actually put the patient under this PET scanner to do the full body scan. So as long as we see any signal or hotspot from the images, we know you have prostate cancer, we know where are they, we know how many are there, and we can see the tumor as small as 2 millimeter size.
Okay, we have to go back to this yellow hat term. Explain that.
Yeah, so it's basic in the medical terms. We're looking for like a disease-specific tumor biomarkers.
Okay.
So a lot of disease like Alzheimer, Parkinson, different kind of cancers, they all carry special biomarkers. Like these markers we're using for prostate cancer is called PSMA, stands for prostate-specific membrane antigen. Only prostate cancer will have that, and they have a lot of that. So meaning if I can identify them, I know where they are, I know if you have them. Right? So if biology identify this marker, now the next thing is we need to create something to looking for that. So the scientists developed we call the radiopharmaceuticals, basically radioactive drugs. It's actually molecules can bind to these kind of markers but tag with the radioisotopes. We inject these drugs into the patients through simple IV injection. It will circulate over the body, actively looking for where the markers are. Once they find it, they will bind to it, and then they will stay there, send out signal. So we put the patient under the scanner. Wherever has the signal, that means where we have the biomarkers, that means where we have prostate cancer, and then that's why we can identify tumors.
Okay, so when we compare this to, let's say, an MRI, what you're saying is that if I go to get an MRI and let's say I have a tiny tumor, it has to be of a certain size for that MRI to detect it.
Exactly.
And with what we're talking about now, how much sooner? So it's like before this tumor really has formed, essentially. You're saying like just the let's break it down for people, just the ingredients, essentially. You're able to see the ingredients.
Yes.
And
exactly.
that's how you can make these early diagnoses.
Yes, you're exactly right. Just give you some numbers. MRI currently, like if you want to see some tumors, I mean that usually it will wait until tumor grow up to like 1 centimeters, around that ballpark. Some radiologists will say 15 centimeters, some will say like 8 millimeter, but it's around that ballpark. And even you see there's a tumor over there, you don't know is that a benign tumor or is it like a cancer or malignant tumor, what we call a malignant tumor. And then so you need to biopsy, you need to go through a lot of process. If it's tumor, it's way bigger than 2 millimeter, what we can detect right now. And if it's like a benign, then you actually spend a lot of unnecessary procedure doing those kind of invasive, uncomfortable process. But using this new technology, we just send this through a simple IV injection. If we see something, we have extremely high confidence to know if I say something, this is actually cancer. Wow. Because the only cancer have this kind of biomarker, and I can see that at 2 millimeter size, which is way earlier than like a 1 centimeter, right? And so that's actually the things. And this is for a cancer field. But when you talk about like an Alzheimer field, what we can do right now, we have a capability and a potential to catch the Alzheimer disease before the symptom coming out.
I want to talk about that, actually. I mean, you've shared cases where, I mean, we will talk about Alzheimer's, but to go back to early stage tumors, You've shared cases where AI caught these early stage tumors. How often does that happen, and how do those early detections change patient outcomes?
It will change patients' outcome dramatically. I think that everybody knows if you catch cancer earlier, it's not a scary disease, right? There's so many ways you can deal with it. So the problems, if you actually identify in a later stage once it's spread out, you don't know where they are, you don't know how many are there, you don't know how they have mutated into, then that makes it very, very problematic. So the very first phase, what we're getting into is using wide variety of radiopharmaceuticals, target different kind of biomarkers, and create a comprehensive map of where our enemies are. We know exactly where they are, how many are there, big and small, and then we can use these kind of the images analyzed by AI, do a lot of not a qualitative but a quantitative analysis, and using that to determine what's the right treatment we need to use to treat these kind of patients. You have a protein ABCDE, and then we're gonna throw the drug ABCDE. And you have a high level, like a 50% more of a A, 20% more of B, and we're gonna adjust the dose of this treatment accordingly. And that's why we call it a true precision medicine instead of one size fits all. Currently, when we're trying to treat a cancer, is that if you have breast cancer, we do a biopsy from one tumor in your body, and then we say, hey, you have one biomarker over there. We just assume every single tumor in your body is exactly the same like that, and we throw the drug into it, hit it, everybody using the same dose, and until this drug doesn't work anymore, we call it drug resistant. This is a wrong method. The precision medicine based on what we want to achieve using this new technology is called intelligence-based precision medicine. We don't guess, we don't try on the error. We know exactly what we're facing, and then we make a decision based on that. So we're gonna offer every single patient the right patients, the right diagnosis, offering the right treatment at the right dose at the right time. And that's what we're doing.
So what you're saying is that your platform is adaptable across different diseases at a highly, highly effective rate.
Exactly.
Which new area are you most excited to tackle next, and why?
So right now, the biggest things of what we're tackling, and it has a huge success, is prostate cancer. Prostate cancer, we know, is a very common disease for men, and there's 1 in 6 men have that. We have 3 million prostate cancer patients living in the United States right now. A lot of men suffering from uncertain diagnosis because the only biomarker we have right now is called PSA blood test. But raised PSA doesn't mean you have prostate cancer. You can only have an enlarged prostate, right? A lot of men receive a lot of necessary biopsy to the prostate, and then also live in the fear for a long time. With this technology, we can exactly offer the men the right situation to catch an early state of prostate cancer that without the need the biopsy. So we can tell you, do you have it? Where are they? How many are there? What's the right treatment? And we can use that to decide where you should use radiation therapy, where you should use conventional surgical, like a HIFU or like a chemotherapy, hormone therapy. And we also have a targeted therapy using these technologies, directly send the radiation to where the tumors are and burn the tumor out on site without hurting surrounding tissues. So right now we really, really have a great opportunities to offer better treatment other than chemo, and it's just not like a 10% better or 5% better like just another new drug. It's totally revolutionized the way we treat prostate cancer, and the same concept can expand it to other cancer and also in the neurological disease.
So if I heard you right, it is not only applicable to early detection, but to people who are suffering from advanced stages of cancer.
Yes, so the whole thing is not just early detection. The whole field is called theranostics. It's a medical term. Combine therapy and diagnostic together, meaning we don't just blindly throw bomb to the patients. We use the molecular imaging to actually identify where exactly the tumors are, knowing how many are there, where are they, and then we actually throw this kind of a targeted therapy into them and burn them on site. We can deliver up to 50 times more radiation dose to tumor compared to use currently big machine in the hospital system. And because the radiation energy will only being released within 2 millimeter size range, so we won't hurt surrounding tissue. So patient almost have no significant side effect.
Whoa, hold on. That's exactly what I was wondering, is how this might change the patient's experience going through chemotherapy. Yeah. And so the experience, the side effects are how much less?
Oh, it's at least 50% or 80% less. It's just a lot of the early phase patients, when we treat a patient, they're just like, did you really put something in me? And because they went through chemo, they know how hard it is. Hormone therapy really destroyed the patients a lot. But when we inject into patients, majority of patients only feel a little bit of fatigue on that.
That's remarkable.
Yeah, and then but the outcome is actually way better than what they have experienced before.
Advanced imaging plus AI, it doesn't sound cheap though. What does a typical patient, insurer, or health system pay for this service, and has that changed?
The most beautiful part is actually this kind of therapy currently is paid by all the major insurance companies. And the technology we keep trying to prove to the insurance companies, we can have, instead of you trying to do the trial and error with all the cheaper like a therapy, which may not even work, and you need to spend more money to treat the side effect. This precision medicine maybe per unit is a little bit more expensive, but the overall cost and outcome is actually way better. And when we use AI, can make it way more efficient compared using the manual method.
So in other words, the downstream savings are what you're pointing to, from, let's say, everything from fewer ER visits to shorter hospital stays and treatments overall.
Yes, exactly. And a better outcome.
That was Dr. Anthony Chang, CEO and founder of BAMF Health. He has a facility in Grand Rapids and is opening a new one in Detroit this fall. His team of healthcare providers use AI to detect cancer and other diseases much earlier than traditional methods. This type of AI assistance also treats diseases with precision so that patients experience significantly less side effects. WDET Newsroom. San Antonio police are investigating the murder of actor Jonathan Joss, best known for his voice work on the animated TV series King of the Hill. He also had a recurring role on the show Parks and Rec. The Detroit Fire Department is implementing a new program designed to reduce response times to emergency calls. The program is called Nurse Navigation. Certified nurses are sent to answer low-priority 911 calls. Fire Commissioner Charles Sims says nurses will be able to respond to issues like sprained ankles or knee pain. The city of Royal Oak is planning to redesign 11 Mile Road between Woodward Avenue and Stevenson Highway. The move could help alleviate congestion by improving left turn lanes. City officials say it also is an option to institute bike lanes and green infrastructure. Construction is set to begin in 2027. The Department of Homeland Security has agreed to restore the visas of 4 international college students, 2 from Wayne State and the University of Michigan, respectively. The American Civil Liberties Union sued the government, which had stripped visas from thousands of students across the country this spring and threatened to deport them. Coming up, we'll land on a launch pad for Detroit's next generation of artists, thinkers, and changemakers. This is The Metro on WDET. Stay with us.